A few months ago, a 67-year-old woman walked into my office. She'd been dealing with chronic digestive problems for 4 years: bloating, constipation, acid reflux, gas. She'd seen 3 gastroenterologists. She'd had 2 colonoscopies. She'd tried 5 different diets. Nothing worked. I watched her walk in, sit down, and right then I noticed something none of her previous doctors had connected to her digestive system: her posture. She was completely hunched forward, and that curve in her spine was exactly what had been crushing her intestines and destroying her digestion for 4 years. Before we go further with her story, we'll come back to her in a moment, because what happened next matters. I want you to do something right now. Pay attention to how you're sitting at this moment. Shoulders falling forward, head tilted toward the screen, lower back rounded instead of straight, body weight falling more forward than back. If you said yes to any of those, and most people over 50 will because it's almost inevitable after decades of modern life, this video is directly for you. What I'm going to tell you today is not a lecture about standing up straight. It's not a yoga video. It's science about how your body's posture directly affects one of the most important systems in your health after 50, your gut. Specifically, the trillions of bacteria living in it that determine how your body digests, how your immune system functions, how your brain produces its neurotransmitters, how your body regulates inflammation, and in recent studies, how long you're going to live. The connection between your spine and all of that is more direct, more physical, more mechanical than you'd imagine. Let's look at it. Something you probably already know, but haven't fully connected to digestion yet. After 50, the spine goes through changes that are partly inevitable and partly accelerated by decades of poor postural habits. The intervertebral discs, those cartilage cushions between the vertebrae, lose water and height. The spine compresses slightly. The muscles that support it weaken if they're not worked. The most visible result, the one anyone can observe in older adults, is that forward curve in the upper back. Doctors call it kyphosis. People call it hunching over. Most people know that hunching hurts the back. What almost nobody knows is what that curve does to the space inside the abdomen. Picture your abdomen as a bag. Inside it are the stomach, small intestine, large intestine, liver, pancreas, all stacked and organized with incredible precision. When you're upright, that bag has all the space it needs. When you hunch forward, the bag gets compressed. The organs get squeezed. The stomach can't expand properly when you eat, so reflux increases. The large intestine, which needs space for its peristaltic movements, that wave of contraction that moves food through, can't work. Gastric emptying slows down. All of that feels like bloating, gas, heaviness, chronic constipation, and reflux that won't go away. That was exactly what was happening to my 67-year-old patient. It wasn't a disease. It was physics. It was geometry. It was that her intestine didn't have the space it needed to function. But that's only the mechanical component. There's another component that's even more fascinating, and it has to do with a nerve most people have never heard of. The vagus nerve is the longest nerve in the human body. It starts in the brain, travels down through the neck, passes through the chest, and reaches all the way to the gut. It's the communication cable between the brain and the intestine, and it works both ways. It sends signals from the brain to the gut, but also from the gut to the brain. In fact, 80% of the information traveling through the vagus nerve goes from the gut to the brain, not the other way around. Your gut talks to your brain far more than your brain talks to it. What does that have to do with posture? When you hunch forward, the upper part of your back rounds and your head falls forward. That compresses the area of the neck and upper torso where the vagus nerve runs. It doesn't cut it off, don't worry, but it does reduce its function. A study published in the Journal of Gastrointestinal and Liver Diseases in 2019 found a direct correlation between kyphotic posture and reduced vagus nerve function in older adults. When the vagus nerve works poorly, communication between the brain and gut deteriorates. The gut receives fewer regulatory signals. peristaltic movements become irregular. The microbiome, those trillions of bacteria living in the gut, starts to shift. The connection that impacts me most from all of this was published in Nature Communications in 2022. They analyzed the gut microbiome of more than 9,000 adults over 60 and found something striking. People with greater spinal kyphotic curvature had significantly lower gut microbial diversity. Lower microbial diversity means fewer types of beneficial bacteria. Fewer beneficial bacteria means more inflammation, worse immunity, worse mood regulation, and higher risk of practically every chronic disease of aging. All of it connected to posture, to how you sit, to how you walk, to how you sleep. Something I think conventional medicine has ignored for too long. We've spent decades treating chronic digestive problems in older adults with diets, probiotics, reflux medications, laxatives, and rarely does anyone look at posture. Rarely does anyone ask, "How are you sitting for 8 hours a day?" That's a mistake, an expensive one in terms of health and quality of life. The symptoms aren't rare or extreme. They're things millions of people over 50 live with as normal for their age. Reflux or heartburn regularly, especially after eating, particularly when sitting or lying down. Hunched posture increases intra-abdominal pressure and relaxes the lower esophageal sphincter, that valve that keeps stomach acid from rising. When you hunch, that valve works worse. The acid comes up. The reflux you've accepted as inevitable may have a lot to do with how you're sitting when you eat. Bloating almost every day, especially in the afternoons? A gut compressed by poor posture doesn't move gas well. It accumulates. That feeling of a swollen belly that shows up even when you haven't eaten badly can be posture, not food. Chronic constipation that doesn't improve even with fiber and water? The large intestine needs space and needs the vagus nerve signal to make its contractions. If posture is compressing the space and reducing vagus nerve function, the intestine simply doesn't move well. No amount of fiber is going to fully compensate for that if the problem is mechanical. Back pain and digestive problems at the same time. These two together are a classic signal of a postural component in digestive issues. Not always. Other causes need to be ruled out. But the combination of chronic low back pain and slow digestion in adults over 50 is so common that when I see it in the office, I always evaluate posture before changing the diet. Anxiety or mood swings with no clear emotional cause? The gut produces 90% of the body's serotonin. When the microbiome shifts because of posture and vagus nerve compression, serotonin production drops. That affects mood in a way no antidepressant is going to resolve if the root cause isn't addressed. Everything we've talked about has a solution. Not perfect, not immediate, but real and measurable. Let's start with the chair. Most people over 50 spend between 6 and 8 hours a day sitting. The chairs they sit in, the living room recliner, the car seat, the couch in front of the TV, are designed for rest, not for posture. They sink you backward, round your lower back, and push your head forward. The simplest and cheapest solution that exists is a rolled towel. Literally, a towel folded into a roll and placed in the lower back, the lumbar zone, when you're sitting. Just that, without any other change, maintains the natural curve of the spine and gives the abdomen the space it needs. It was the first thing I told my 67-year-old patient on day one, and it was the first thing that changed. The phone deserves a mention, not because we brought it up in the thyroid video, but for a different reason here. Looking at your phone with your head tilted down adds between 44 and 66 pounds of extra pressure on the cervical spine. Every inch the head falls forward multiplies the weight the spine has to support. Repeated for hours a day, it accelerates kyphosis and compresses the torso. The solution isn't to give up the phone, it's to raise it. Bring it to eye level instead of dropping your head toward it, a gesture that seems silly and that can change the mechanics of your spine throughout the day. 2 exercises, just 2. Because I know that if I give you 10, you'll end up doing none. The first is called a chin tuck. You gently push your chin backward like you're trying to make a double chin. Yes, that glamorous. And hold for 2 seconds. That activates the deep neck muscles and corrects head position. 10 repetitions, 3 times a day. The second is sitting on the edge of a chair, interlacing your hands behind your head and gently extending backward over the chair back. Hold for 3 seconds. That opens the chest, stretches the muscles that hunched posture shortens, and gives the intestine immediate space. 5 repetitions after each meal. Those 2 exercises done consistently for 6 weeks produce measurable changes in posture. Studies confirm it. And in many patients, noticeable changes in digestion. 3 weeks after that first visit, my 67-year-old patient sent me a message. It had been hard for her to remember the towel, hard to remember to raise the phone, hard to do the exercises consistently. But she'd done it. She told me, in these exact words, "Doctor, for the first time in 4 years, I woke up without feeling my stomach bloated." 4 years, 3 weeks, a towel, 1 exercise, and a change in how she used her phone. Not magic, physics, giving the body the conditions it needs to do what it already knows how to do. How many times have you been told your digestive problems are normal for your age? How many times have you left a doctor's appointment with 1 more medication but no real answer? How many years have you been living with bloating, with reflux, with a gut that just doesn't work right, assuming that's how it's going to be from now on? It doesn't have to be that way. Not because I have a magic pill, I don't. But because in 20 years of medical practice, I've learned that the human body has a capacity for recovery we constantly underestimate. That when you give it the right conditions, even something as simple as a rolled towel and 10 minutes of exercise a day, it responds. It always responds. My 67-year-old patient didn't need surgery. She didn't need a 6th gastroenterologist. She didn't need a more restrictive diet. She needed someone to look at how she was sitting. Maybe you do too. The body doesn't age in a straight line. It ages according to the conditions you give it. And sometimes the most important condition isn't what you eat or how much you exercise. It's simply how you treat your spine every day, because your spine isn't just bone, it's the axis of everything else. If this video gave you something today, share it with someone who's been dealing with digestive problems for years without finding the cause. And tell me in the comments, how many hours a day do you spend sitting roughly? No judgment, I just want to understand the audience's patterns. Subscribe if you want more content like this. Take care of yourself.